I think it's really helpful to differentiate what a psychiatrist does, a psychologist, what they do, and then where do you fall into that as a clinical pharmacist?
So a psychiatrist is a physician, of course. They've gone to medical school, they've done residency, oftentimes doing fellowships. And from a practice perspective, they can do therapy, so like psychotherapy. They, of course, prescribe medications, they diagnose, and have a really good understanding of like the bodily processes, like anatomy and physiology. A psychologist doesn't have like the medical components, but they specialize in the psychotherapy. They approach it from like the research kind of perspective. They also diagnose. And, I've heard of some psychologists being able to prescribe some meds, but the system that I work within, like they don't prescribe meds at all. And then pharmacist. So I specialize in like medications. I do what's called comprehensive medication management, meaning I can initiate new medications, titrate doses, order labs. I put in referrals for care, for like therapy, for instance, since I don't do therapy as a pharmacist. So I can identify when a patient might benefit from therapy, and then I just put in a referral to one of my colleagues so they can be plugged into that type of a service. And so like the kind of differentiating factor is that like I don't diagnose and I also don't do therapy. And, just thinking about like the years of training that maybe a psychiatrist does compared to like what a pharmacist does, like there is a certain level of like, okay, we need to collaborate, right? We need to collaborate when it's appropriate. And so you just have to know when that's, when you need to reach out and do all those things.